Hello again. Welcome to Ask Dr. Pane. Today's question is from a woman who does not state her age, but from the photographs appears to be in the early 50s and is concerned about a natural looking facelift, facial rejuvenation, questioning implants, what procedures can be done, and there's pictures from the forehead on down. Now here it's hard to say because you could do everything. You could do different combinations of procedures, and you're going to get a lot of different opinions depending on who you see. So we'll kind of stick to the general principles. For the upper forehead area, that is likely going to be some sort of injectable like Botox, Dysport, or Xeomin. I'm not a real fan of the brow lift for this person's anatomy because I don't think the brows are low enough to justify that procedure. The upper eyelids and lower eyelids also could be done. There is some excess eyelid skin hanging onto the lashes. Now, if that's a concern, it wasn't stated. That could be done. The lower lids have some mild fat bulging, little bit of skin excess, so a standard lower blepharoplasty would work well here if that's a concern. That can be done at the same time as a face and neck lift. Here, there was actually more happening with the neck than with the face, very slight jowling. But again, done judiciously and without over pulling, the facelift result is very natural and the scars are hidden. And that can be done in combination with the eyelid surgery. Regarding the cheek, I'm not a huge fan of cheek implants. They do have some utility, but oftentimes the fat transfer to the cheeks can be better because it's a more natural result and it doesn't have some of the downsides that can be seen with an implant procedure. And then regarding the overall facial rejuvenation, here we're talking about skin care. That can be done either alone or after these surgical procedures, depending on what they're looking to do. There are medical grade skin lines that can help with hyperpigmentation, small fine lines, and some of the sun damage type things that can be seen on the skin. Or you can get even more involved and get into lasers and things like that. That is also an option. So again, there's a spectrum there from lower, intensity procedures all the way up to the higher intensity things, and they have corresponding differences in pros and cons of each one. But here, thinking along those lines, the injectables for some of the lines, fillers, adding some volume, although here I'm not talking about off-the-shelf fillers, I would be talking more about fat transfer, although it's possible to do other things for the cheek, and the face neck lift to restore that's going to be the big one. That's going to restore the most youthfulness to the face without overdoing it. And again, surface issues with talking about fine lines and hyperpigmentation as an overall thing that can be done before any surgery or after, depending on what the person is looking to do. So those are the general areas to consider when looking for a comprehensive face consult. And it's a good idea to get sometimes more than one because you're going to hear different things depending on people's training and background. We tend to do pretty much everything, so we'll present it not so much as a specific procedure, but a spectrum of possibilities to address each one of those issues. And again, we're capable of doing all of that. So we try to match the procedure to what you're looking to do. So hope that covers it, and we will talk to you next time.